Good morning. This is Elizabeth reporting for KJTV News. We begin this morning with a developing and deeply tragic story out of West Texas. A second child has died in Texas due to the ongoing measles outbreak that continues to spread across the state and beyond. The young girl, identified as 8-year-old Daisy Hildebrand, passed away last Thursday from measles pulmonary failure, according to officials at University Medical Center Children's Hospital in Lubbock. Daisy had no known underlying health issues but was unvaccinated. Her death marks the second child fatality in Texas since the outbreak began in late January, centered in Gaines County, an area where vaccination rates are just 82%, well below the 95% threshold needed for community protection. Over the weekend, U.S. Health and Human Services Secretary Robert F. Kennedy Jr. visited the child's family in Seminole and attended her funeral. Although Kennedy has previously questioned vaccine mandates, he has acknowledged in a public statement that the MMR vaccine, measles, mumps, rubella, remains the most effective way to protect against the disease. He confirmed that Texas alone now has 499 measles cases, contributing to a nationwide total of 642. The outbreak has grown rapidly. The Texas Department of State Health Services reports a 14% increase in cases in just 1 week, with 481 confirmed cases as of Friday. 6 infants and toddlers have tested positive at a daycare center in Lubbock, and at least 56 individuals have been hospitalized due to complications. Neighboring states are also affected. New Mexico has reported 54 cases, with 10 in Oklahoma, and additional infections stretching into Kansas. Officials believe some cases in Mexico may also be linked to the Texas outbreak. Medical experts and public officials are urgently calling for increased vaccination. Dr. Peter Marks, former vaccine chief at the FDA, called this death absolutely needless and emphasized that vaccination is the key to prevention. Former U.S. Surgeon General Kenneth Moritsugu echoed those concerns, warning that declining childhood vaccination rates may result in more preventable deaths. In response, Secretary Kennedy said he has redeployed CDC teams to Texas to assist with vaccine distribution, contact tracing, and outreach to local communities, including religious groups. He also spoke with Governor Greg Abbott, offering continued federal support. The CDC confirms that 95% of this year's measles cases involve people who are unvaccinated or whose vaccination status is unknown. Despite some parents turning to vitamin A supplements, doctors warn these can be harmful and are no substitute for proper medical treatment. President Donald Trump commented on the outbreak while aboard Air Force One, saying that if the situation worsens, his administration is ready to take very strong action. Meanwhile, health authorities are urging the public to follow safety protocols. Wash hands frequently, use tissues when coughing or sneezing, avoid sharing personal items. Stay isolated if symptoms develop. Measles, once declared eliminated in the U.S. in 2000, has made a troubling comeback due to falling vaccination rates. Symptoms begin with fever, cough, and runny nose, followed by a rash spreading across the body. In severe cases, it can lead to pneumonia, encephalitis, and even death. Health officials predict the outbreak may last for several more months. As part of his efforts, Secretary Kennedy is set to begin a Make America Healthy Again public awareness tour across the Southwest. UMC Health System Vice President Aaron Davis stated, "This unfortunate event underscores the importance of vaccination. We encourage everyone to stay up to date with their vaccines." Our thoughts are with Daisy's family and the many others affected by this growing health crisis. For ongoing updates, stay with us here at KJTV News. Thank you for watching us, and don't forget to subscribe for more updates around the world.